knows that now. Sarah, do you have our little slides to officially read out to folks? Go. This meeting is being held virtually and is hosted by the Utah Department of Health and Human Services Center for Medical Cannabis. Public notice of this meeting was provided as required under Utah Open Meeting Code and posted on the Utah Public Notice website. Board is to review available research literature and assist DHHS and Center for Medical Cannabis in their efforts to provide useful treatment recommendations to qualified medical providers regarding the use of cannabis and cannabinoid products for treatment of certain medical conditions identified as qualifying medical conditions. Recording of this meeting will be posted to the Utah Public Notice website within 3 business days following the date of the meeting. Written minutes will also be prepared and approved minutes will be posted to the Utah Public Notice website within 3 business days after board approval. Well, there's our list. I think we've got everyone here minus Misty at least. We'll have a public comment period. We'll invite anyone who's there to hold their comments till the end. We'll give each person 2 minutes and ask you to raise your hand, state your name, say who you're affiliated with, and give your comment. And then we'll either try to hear all the comments together. If there's something particular, have the board ask some follow-up things, but ask that you save your comments to the end if possible. First up will be to take a look at minutes from last meeting in February to see if anyone had any changes or edits there. If you want to scroll through them, Sarah, I think everything looked good to me. Any changes to those minutes from anyone?
Oh, looks good.
Approve.
Approve.
Person there.
Do you need a second? I'll second it.
Sure, second, I guess. Whatever the rules are for each of these. Then, all right. Everyone in favor of approving the minutes? Raise of a hand there. Great. Looks good. Everyone there. I think that brings us around to Russ to show us the final polishing that happened on PTSD document. That was definitely a group effort. But I guess Russ, you've had a big hand in if you want to show if there's any other final things or changes that we need to look at before we say yes to this.
Yeah. I went over it quite a bit. I didn't see anything else. I love, first of all, the new format. It's just much easier to target in what you want to look at. And the thing that I think we were working on, I think you've edited it, Mike, was that page 9. That was our biggest edit, where we wanted to be clear on, how we approach it and our recommendations. And I think you hit it really well, putting in the sections on the APA and the Department of Veterans Affairs. Unless someone sees something else, that was the only thing I was really focused on, because that's where we were trying to be more clear in putting cannabis in context.
Include like 80% of what Lauren had in her slides about those studies, but I tried to just give the quick highlights of what are these studies and what did they look at.
Right.
Hopefully it's still, got enough in there to make sense to people.
Yeah. I like the fact too, the document's not overly lengthy. It's fairly concise for what it is.
I personally think the table is really useful. I mean, I think people will go to that, look at that, rely on that, probably more than they'll read the document. And so I think that's great.
Yeah. Yeah. And it looks like the rest of the edits were mostly just, small grammatical changes.
Top you had there, Taylor, about the language, the one that was still.
I'm not sure which one it may be. I did, I thought at least on the parts where if we're saying something was important to like have some kind of something to like an icon that would draw your attention to it. Something more than just bolded text, but that was about it.
I did put one in
Oh,
the
yeah.
I like
epilepsy
that, yeah.
one, so I can move that over to the PTSD one if we like this icon.
That was exactly the one I had in my head when I was like
Yeah.
writing that comment, but yeah.
Yeah, I like that
Awesome.
too. Yeah.
Okay, yeah, I can add that into the other document.
It to me just looks like the font for guidance is smaller than the font for like the important note. I don't know if that's just an artifact of Zoom here.
Yeah,
Just
I
that
think
I suppose our guidance should be the biggest thing.
yeah, I'll make sure that they're all the same. I think I just missed that one by accident.
To point out or that needs discussion from the board, Russ, on the edits.
Yeah, I mean, other than the small things we're making now, I mean, I was just looking at that text that you said you were going to clean up, and I really liked what you had written there. Let's see what.
Saying CBT or DB, whatever other pieces, just said, here's the list of things that you might try if that's something you need to know more about. We're not commenting on the benefits or details of any of those different therapy modalities. And there's those
Right.
links that you had already mentioned.
Right.
Cannabis use disorder, especially with the PTSD and this sort of veteran substance use population, was good there, Taylor. So
Yeah.
I like that.
No. Yeah, I think referencing those two organizations and their approaches is really important. I think it looks great. I do like the addition of the exclamation point at the beginning.
Shall we take a vote then? A motion to approve this final version of the PTSD?
I'll make the motion to approve.
I'll second it. Discussion?
No one discussed any more discussion, last chance.
It follows a second. You have to allow for one more discussion after a second. But I think it looks awesome. I
Yeah.
love how we can make it more readable because like Taylor said, most people are looking for one thing. They're not going to always read from top to bottom. So making it stand out what you're looking for is really important, I think.
Yeah.
Bonus discussion. Favor of approving the PTSD guidance document. Looks good, unanimous from the board that's present. Looked at my email 3 minutes before signing on and realized that Misty wasn't coming to talk about the epilepsy document as she's out of town. We can pull it up and look at it to see. Russ, were you involved in taking a look at it with her or anyone else? That
she mentioned that she would connect with me, but I never heard from her, so I just presumed that she was either too busy or had handled it.
Looked through it and it looks like this one was much more simple than some of our prior ones. So
Yeah.
we're in the strange thing where we're not scheduled to have any more meetings with the ending of the board as far as looking at what these edits would be and how to have a discussion there. And Taylor, you've gone through some things. I don't know if you had any just broad comments to bring to everyone beyond what you've got in here.
Yeah, I kind of called out one example, right there where you've got the document pulled up, but or where Sarah does, but I as you read through it, and I remember this when we went through the studies with Lauren, which, I mean, that was all amazing review as always, but with this subject in particular, I was a little confused. I was like trying to follow what the results were telling us, and this paragraph is kind of one of those examples where it gets a little bit, I guess, convoluted,
Yeah.
because they have, a result that's statistically significant. But then, if in like the broader literature about what's a clinically significant difference for a seizure, they would need a difference that's bigger than the statistical significance they saw, or like at least what the effect size was. And so there, as you read it, the way I understand it is to say, like, yes, there's statistical significance based on this threshold we set, but it probably wasn't a good threshold to set because our effect size wasn't right to be clinically meaningful. And if we look at it that way, then we don't see a difference. And so
Should have just been a 50% reduction in seizures or something, and that's what they should have measured instead of hunting,
right.
p-value hunting. Yeah.
But just like even having some kind of like succinct statements to kind of, maybe try to guide the reader of this through that kind of nuance. And that could be up at the top and like the intro paragraphs where there's like a kind of a summary at the bottom where we've got bullet points, and just kind of putting some of that in there to explain, like, just so you know, like there's this kind of nuance that's in there. You decide how to handle this, but this is what the literature shows us. Because I think if you read it and you're not, particularly, you're not reading the New England Journal every week, and it's been 20 years since you took your epi class, then you're probably just going to be like, I don't know what I'm reading here. So
Saying like exactly what you've got in quotes there, wherever it belongs, I think would be good as, guiding the reader of how do you interpret epilepsy literature for outcomes. And I think that'd be a fantastic thing to include, either whether it's right before this study or just kind of a general comment higher up would be. End of that intro section, that last paragraph of that introduction right before cannabidiol right there would be like a good place for it, as we're talking about, they show a decrease in seizure frequency, and then we can then at least massage that sentence into that paragraph.
So what would you label it? Like editor's note or something like that?
We're allowed to comment and interpret the literature, and if we call it editor's note or we just say it, I don't know. Did we have something like that in the other document you said too, Taylor? I didn't recall if we had that, or
no,
if we
it
would.
was just
I know we
this
generally
one.
talk about effect size sometimes, but I don't know if we call it
Yeah.
out like that.
Yeah, I don't know if you need to separate it out from like the format that we already have. You could just put it somewhere, either in these paragraphs where we are currently, or there's also some bullet points. You could put something about it in both places too. There's no reason why you couldn't do that, but that was at least the way I'd kind of thought about it.
If it's an important point, I think easier to identify if it's separated out. Otherwise, it might get missed.
So Sarah, when you go down, I think it may actually be after the cannabidiol section. Yeah, those things to consider. You know, one of the things you can consider is like interpretation of the evidence, you know, like it just is one of those things to consider and say, you know, there's, you know, what was statistically significant and what is clinically significant. And that's an important distinction about what you'd recommend to somebody.
Does that verbiage seem okay, or do we want to adjust it?
It definitely include, you know, something that says, you know, what is often considered clinically significant in epilepsy literature. And I don't know what that standard is. That standard is 50%, like we said, then that's great. And probably include some reference for that. And maybe people who are very, very familiar with epilepsy literature know it. I don't know what that frequency is. So probably good to call that out. And what does that mean, right? If you have 20 seizures a month and now you only have 19, then that's not a clinically significant difference. Mark that for some, yeah.
Yeah, it's definitely getting there. That's okay.
Else recognize, did we get things updated in this yet, or was that something Misty was working on that we don't have, at least in whatever this version is, as far as adding new things in from Lauren's updated presentation?
I don't think much got added besides the comments we saw in the beginning that I started to accept, so I don't know if that got completed.
Yeah, from what I can tell, it looks like we haven't been able to add the newest studies yet, if you wanted to add any of those.
Back later this week, and we can check with her and see what's missing. I guess my question is, how do we proceed with an incomplete document with our last meeting here on how to resolve this and then re-vote on it? I don't know if there's a path for that, Rich or Sarah, as far as making that happen. I do some other things that are less formal boards of like votes by email, but I don't know what would. I don't want to leave things hanging open as we transition this over to the U.
Yeah, what I'll do is I'll confirm internally and get back to the board by email to let you know. I think this is something that we can handle in an email exchange. And also it can be part of our transition with the University of Utah Center for Medical Cannabis and Valerie as well. I know there's an informal group meeting up to discuss the transition to the University of Utah, and they could play a role in helping us move this forward.
Of course, any public comment would be welcome, and I don't think we're anticipating making a major change to the language of like the bottom line guidance around the use for epilepsy. So it's not what we're going to surprise everyone with a totally different recommendation.
Right. Yeah, so I'll circle back and research that and then get back to you and let you know by email.
Michael, what I'd say about this, you know, with the studies not yet added, again, the studies as I saw them in this particular case were, I think there were more trials, there was more nuance, there was more depth and more complexity in terms of the pharmacology on this topic than some of the others, mainly because we have an FDA approved medication in this particular, for this treatment, for this condition. So I think that it lends itself well, again, perhaps even better than the PTSD document, to a table. And so if Misty's up for that, or we're up for that, or the, newly adopting Center for Medical Cannabis is up for that, we could even recommend that to them. But I guess if I recommend it to them, I'm assigning myself, because I'll probably be over there too. But
Handing it to Misty and to you and to me and all the rest of us, so if we're all carrying on. But so
Yeah.
that could be, if somehow we're left with, we would have to reconvene the board for a public meeting to do this, or something, that we could just leave it to have CMCR do. We'll see what Rich says, but I agree we can do that,
Yeah.
and see if we can add some summary pieces there.
Yeah, that seems reasonable. I'd be surprised if we'd have to reconvene. I don't think we will. It's just a matter of passing the baton to the University of Utah Center for Medical Cannabis Research to do some analysis and then to make some recommendations to DHHS. So.
All right, guys. What else was I going to say there? Okay, no, I think that looks good, and it's not like this is the final say on this, because this is being handed off to someone else. So it's not like this is all completely done, like you're saying, Rich. It's being handed off. So whatever we come up with, we'll work out.
Great.
Your turn.
Yeah, before I get into the 2025 legislative session, I wanted to just share one of that we all know is that during the session there was a sunsetting of the Cannabis Research Review Board, and so that becomes effective on July 1st. And I wanted to give the Assistant Deputy Director for DHHS, Amanda Slater, a chance to share a few thoughts as we sunset the Cannabis Research Review Board. So I'll turn the time to Amanda for a moment.
Rich, and thank you all for letting me just take a moment. I just wanted to, on behalf of DHHS and our executive director, just thank you all for your service on this board. It's been invaluable as you take on the challenge of looking at the research, making sure that we're focused on evidence-based guidance for safe and effective treatment of medical cannabis, and making sure that we're educating practitioners. So just really wanted to offer a very heartfelt thank you to you all. Special thanks to Dr. Michael Moss, who's been the chair of this board, and to the past board members, Dr. McKiff, Dr. Carlson, and Dr. Fine, and Dr. Red. Just thank you all. I know it takes on a lot to be a board chair, and so we appreciate that. I know some of you are moving on to the other advisory boards, such as the University of Utah Cannabis Medical Research, so we appreciate that. Your commitment's been really invaluable, and I just wanted to take a second to thank you for that and appreciate your good work to make this medical cannabis program successful in the state of Utah. So thank you. With that, Rich, I will turn it back to you.
Great, thanks, Amanda. Yeah, so a few of the other changes besides the sunsetting of the Cannabis Research Review Board that I just wanted to take a moment to share is in regard to patient education, that is something that we've always felt is important. And I know board members feel strongly about that. And there was a bill that passed that created patient product information inserts for cannabis products. And these will provide patients information on how to use the product, dosage, side effects, and contraindications and safe storage. And the plan is to have it be either a QR code or a web address link that'll be, if it's in an email or a text, it'll be sent to the patient. digitally, or it could be a piece of paper that the pharmacy provides to the patient, and that piece of paper could have a QR code on it, or it could be for those that want a physical one pager front and back of the patient product information. They could also request that. And so that we're hopeful that a lot of patients will find that helpful, especially those who are new to medical cannabis. And in addition, in the topic of patient education, product labels are required to include a warning to pregnant and breastfeeding women. So there's some other warnings, and this has been added to those warnings that already are required to be a part of a product label. Also, in regard to staff education, employees of recommending medical providers will complete a yearly privacy training before they can access patient information in the electronic verification system. So that's important just because we at DHHS are responsible to oversee the electronic verification system that has all of the records regarding the who has a medical cannabis card, and the information that the medical provider, the physician, is trying to share with the pharmacist to ensure that the pharmacist is aware of that patient and what some of the items related to their care have been. So anyway, we want to make sure we protect that system, and this will help us do that, this privacy training that'll be required of those employees of the recommending medical providers. Also, with respect to reduction of regulatory burdens, the pharmacy medical providers, the pharmacists that work at the facilities, they are still required to do continuing education, but they're able to do that with self-certification, which is just simplifies the process and makes the application for that initial registration as a pharmacy medical provider a little simpler. And also the 4-hour continuing education requirement for recommending medical providers, that was simplified to accept completion of medical cannabis education from what in the words of the bill were called informal sources. So in the past, it's always been formal sources of education, but lawmakers wanted to complement that, supplement that with informal sources as well. So that's a bit of a reduction of a regulatory burden. And also, beginning in July, there will be an elimination of the medical provider application fee. So recommending medical providers are no longer required to pay a $150 initial application fee and a $50 renewal fee when they renew. There won't be that requirement any longer, and so that will also that represents another reduction of a regulatory burden. And there will no longer be the term qualified medical provider or limited medical provider after June. In July, we'll just use the term recommending medical provider. And all of the recommending medical providers will be able to recommend to up to 1.5% of the total active medical cannabis patient population. And so that is a significant change as well. Also, another item is in regard to letters of concern that Utah Department of Ag and Food does, except for a violation that threatens public health or the third violation of the same rule or statute in a 24-month period, a UDAF will issue a letter of concern before taking other administrative action. So lawmakers wanted to make sure that letters of concern were used in those first violations opposed to fines when Department of Ag takes action. So that was another legislative change that happened. In regard to patient access, There will be an issuance of 2 additional cannabis pharmacy licenses. As many of you know, right now there's 15 existing licenses. And so this, the 2 additional will bump that total to 17. But there's a few conditions that the additional 2 pharmacies must meet. The license issued before January 1, 2026. That's one of the requirements, is that there be one of those issued before January 1, 2026. And they must commit to operating the license for at least 15 years. And then the license issued before January 1, 2027 may not own any interest or operate or be owned or operated partially or entirely by a cannabis production establishment. So it won't be able to be one that is vertically integrated. And then both of the licenses are going to be issued to entities that do not already have a medical cannabis pharmacy license. So it can't be the second license that an entity is receiving. And then also the 2 licenses must be located in an area designated as a medically underserved area as determined by the Federal Health Resources and Services Administration. And located in a 3rd, 4th, 5th, or 6th class county as determined by the federal government. So also there'll be some increased consideration given to applicants who indicate a willingness to locate the medical cannabis pharmacy in an area or a population center designated as a medically underserved area. And then also if they indicate interest in operating as a home delivery medical cannabis pharmacy that accepts electronic medical cannabis orders. So that change is expected to increase patient access, obviously, in those areas that are underserved. And then in regard to public health, there's some cannabis odor standards that are being given to UDAF to further define in statute with help from local municipalities. And so they'll work with the local governments on that, and then they'll also purchase some equipment to help them do testing for compliance to the odor standards that are going to be established. So those are just some of the changes. One thing I forgot to mention as I conclude is there's a reduction of some fees. Senate Bill 8 reduced the uniform transaction fee collected from each cannabis product sale from $3 to $1.50, so cut in half. This is a fee that is collected upon each purchase. And so beginning in July, that will change from $3 to $1.50, and that's revenue that DHHS collects. And so that'll have impact on us and obviously impact on patients where that fee will decrease. And then also for individuals applying for medical cannabis patient cards, their application fees are going to be reduced from $15 to $8, and that's for an initial card or a renewal card. And so that increases access to the program, makes it just a little bit more affordable for patients. And yeah, that gives a high-level summary of some of the changes that happened during the legislative session. And are there any questions about those?
Budget rich with all of those cuts to those various fees, or who gets impacted. Certainly nice for the patients and the providers to pay less, but does that mean that your staff gets cut back, or well, do you know what's going to happen with that yet?
We don't anticipate that. What we anticipate is that we do have an increase that's happening in the number of purchases that are being made of medical cannabis throughout the state. And so that helps absorb the reduction in the fees when we have a higher volume of purchases being made. And so that's a factor. One thing that we do know is if in the future there's ever a need for us to raise fees, that's possible. We would just need to coordinate that. But we started with these fees the way they are, and we always knew over time there would likely be a need to adjust them after the program started. And the program's been operating for 5 years now, and we started with a $3 transaction fee and a $15 application fee, just based on projections of us needing to pay back a loan that we took out from the general fund that lawmakers always intended for us to pay back. And we just barely paid off that loan just this past year. And so because of that, you know, our burden for paying back the loan is gone. So that's part of the basis for lawmakers decreasing our fees is, okay, now you've paid back your loan. Now you should be able to decrease your fees because you're not paying off the loan anymore, right? That was some of the basis. And
Just
so
didn't want to make sure as we transition away that you don't disappear as well as the over at CMCR, that now there's no one home or the lights turn off and there's no one there or something. Yeah. Okay.
No, we're not worried about that. We've done some projections with our budget manager, and we do expect to be okay based on our projections. But it could be in 2 or 3 years, we need to circle back with lawmakers and tweak things. And that's how new programs operate, right? You kind of find the sweet spot that allows you to cover your expenses as the program grows and to bring in sufficient revenues that allow you to cover the cost. Because, you know, we also have some priorities of obviously covering the cost of the software is a big deal, covering the cost of staff that allow us to support that software and that allow us to work with researchers and coordinate with stakeholders and work with the Medical Cannabis Policy Advisory Board, right? These are all important operations that we have, and working with the Compassionate Use Board as well, right? Supporting those patients that are minors. So yeah, we'll always make sure we have sufficient funds to cover the services, and yeah, we'll just continue to coordinate with lawmakers if needed in the future on those fees. Other comments or questions about any of the legislation?
Rich, just one question about the recommending or prescribing limit that providers have. I think you said it's a 1.5% of the total number of. So, I mean, I'm guessing they did that just because that's a large number that most people would never reach, but I imagine that there also are places that do, like, you know, they kind of dedicate themselves to being card issuers and probably have large numbers. So is that like a number that will be like updated in real time, so that if like the population shrinks a little bit or increases, then if you're approaching that limit, which I think is in the thousands, someone would come to you and say, hey, you gotta cut back on the number of people you have, because now the population of active users is contracted and you're above 1.5%, or how would that work?
Yeah, so the way we've decided to implement that internally is to set the limit quarterly. So whatever, like in the past, it was at 1,399. And then just during the past quarter of we just finished the first quarter of the year, right? With January to March 2025 having gone by. And that increased the 1.5% is equal to 1,473 patients. So that's the current limit. And over time, we increase it quarterly as the total number of cardholders increases. Yeah, that's how we handle that. And then we inform medical providers about that limit, so they're aware that there's a quarterly newsletter that we're just about to send out, and we'll ensure that medical providers that are participating in our program are informed of that limit, so they can comply with it.
So if there was ever a quarter that shrunk, would they ask people to kick people out of their programs, or would they just say, stay where you're at?
Stay where you're at. We wouldn't require that they kick people out. No, that's right. Yep. So it can only increase over time, the limit. So if there ever were a time where it went down, we would just keep for those that had already gone over, they would just stay where they are. And then for those that are below that new limit, they would just be required to stay below it. Any other questions? And also, just so everybody knows, total active patients as of the end of April of 2025, or the end of March, excuse me, of 2025, reached 97,935. But this particular month is a month when it's very popular to renew your card. So we've already, I think, gone over 98,000, and maybe we're in 99 right now. We do expect that later this month, we'll likely get our total active patient number will reach over 100,000, based on our projections. So that will be a milestone for the program. Other items? Okay, well, yeah, I'll turn it back to you, Mike.
For getting us updated. Lots of activity with the legislative session this year. Sarah, your turn.
Yeah, so I do have a presentation just over the board accomplishments and the page analytics, but before that, some research and education updates. We're working to update our whole website, so that'll be a lot more user-friendly. We got a mock-up of the new website pretty recently, so I think probably by June we'll have that completed. So just a heads up. And then Rich mentioned this, but we have the newsletter coming out April 15th. So if you want updates for that, you can sign up on our website. And we'll also have a legislative summary of all the items that Rich just discussed on our website and also in the newsletter. So if you're interested in that, those will be posted once they're approved. And then, yeah, I made a little presentation to kind of go over our accomplishments from like the past approximately year. So some of the board accomplishments are that we reviewed and updated all these guidance documents since January 1st, 2024. And we've been meeting quarterly, so I feel like this is pretty good progress with how often or like infrequently we meet. So we updated the Crohn's and ulcerative colitis document, HIV and AIDS, PTSD and epilepsy. We talked about during this meeting, so those will be completed shortly. And then we created a new guidance document for persistent muscle spasms, and then increased partnership and collaboration with the University of Utah. And you guys helped cultivate this relationship, and the work of the board completed will provide a foundation for future research facilitation. So I feel like we did a great job of laying the groundwork, and we'll transition over to CMCR really nicely, just with how we've run the board. And then these two I thought were really great accomplishments and have been really helpful for patients, providers, people who come and visit our website. But the content for the important information for medical cannabis webpage, that's been so helpful for people. We've shared that with our newsletter subscribers. We've shared it with patients when they apply for a card and renew a card. They get that in an email that links to the webpage. I know Dr. McKiff's talked about it in his presentations. I believe Rich has as well. We've shared it with other states through CANRA, which is a national network for cannabis regulators. And we've talked about it with McPAB. And then on our website, we have a need help navigator, and it's a resource there. So people are accessing this website or webpage in a lot of different ways. And you guys really helped create that. And yeah, it's been really great. And we're going to use this content for the patient product information insert, which Rich mentioned in the legislative updates. So that'll be either QR code or a web page that they can access. And we'll also have a printed version with that information. So I feel like that content is reaching a lot of different people. And then the medical cannabis patient assessment checklist has been another great resource that you guys created. That's been shared in the provider newsletter, shared in presentations, shared it with other states, and shared with McPAB. So yeah, and it's cool to see. I'll show the analytics for these, but both these web pages are being accessed a bunch. And yeah, it's cool to see that they're being used, and seems like they've been really helpful for people. So for the patient assessment checklist, I took these from Google Analytics, and it kind of shows an overview of how many people are visiting it. So I think we launched that page around October, and you can see that there's a big spike in like December of it being used. And January, I think we included in the newsletter then. So you can see the views 1,468, which is pretty high. And then active users, so people actively engaging with the page, 964. Views per active user, so people 1.52. I believe that means that they're coming back to the page. And then the way that I can tell people are kind of actually using this page instead of just opening it is with the average engagement time per active user. So they're on the web page for over a minute. I feel like if you were just clicking and opening it, it would be a lot shorter. And yeah, so I thought that was cool to see with the patient assessment checklist. And then for the important information about medical cannabis webpage, that one was launched in January. And I'm sure that these are going to go up soon too when we send it again in the newsletter, but 644 views, 406 active users, 1 minute and 29 seconds for average engagement time. And yeah, so just some stats to kind of show how the pages have been used. And then just wanted to say thank you for all your hard work on the Cannabis Research Review Board. I feel like we've done a great job this year of creating documents and having things be helpful and creating resources that people will use. And then I'll go back to the agenda unless there's any questions. One other education update that kind of prompted me. So I know we like the format of the new documents that we shared today. I've been updating those on our website. I'm trying to go through all of them and just keep them uniform because they're all pretty different. I've gotten through like over half of those, but yeah, I'll be updating those on the website so that everything looks similar. I think those are all the updates from me. If anyone has any questions.
Yeah, big thanks to you for all this and everything else that you do to keep the board running and keep us on top of what we're supposed to be doing and what our tasks are, and all your behind the scenes on updating all those other documents and bringing that stuff together. So
Yeah, thanks,
we would
Sarah.
definitely not be doing this without you.
Yeah,
Thank
definitely.
you.
I don't see Valerie signed on for our next piece. I don't know if anyone heard from her. I've been emailing her about a few other things the last couple days, but I wasn't sure if she was planning on making it or if she wasn't going to come until for another half hour or something. I didn't hear from her. Did you, Sarah or Rich?
No, I did send her an email at the beginning of this meeting just to check in because I saw she wasn't on here, but I haven't heard back, so I'm not sure if maybe something else came up.
So that's so critical because I believe everyone who is interested has been in contact with her, and
Yeah.
we have some things set up. And I think, is everyone of our current board members who's planning on helping out with the new CMCR group? Was that everybody here? Is we're all gonna
I think it's just gonna be a different
out if you
Zoom
want
link.
to.
Yeah. Same people, different Zoom link. Yeah.
Yeah.
And hopefully we'll be able to bring in some additional people, because we won't be operating in the, we'll have some different sort of freedom and room to do things. So if there's anyone else wants to talk about right now in this setting, or if it's better for us to just wait to talk with Valerie, we can use a few moments to talk about any transition issues, or Rich, if you think, or Sarah too, if there's anything else we need to discuss right now, even if Valerie's not here.
Yeah, I think I can just say that we're excited about what the future is with the University of Utah Center for Medical Cannabis Research. And while we're excited for that, it's a bit sad to see the board sunset, but it's really helpful to go through all the accomplishments, all the resources that the board has helped us create. And it really did for these past years. I mean, the board began, its first version was in 2017. And then as legislation came up in 2020, when the program launched, it became really important. We started to use the board even more, right? And over time, our resources have improved as we learn more and as we bring more people in, right? And so we're really pleased with the foundation that's been set. And we're excited to be able to work with our partners at the University of Utah Center for Medical Cannabis Research. And we're also excited to see what research the University of Utah can facilitate within the state of Utah, as they are stewards of some grants and funding that they offer to researchers that are looking to make medical cannabis a focus of reports and studies that they do. So yeah, those are some of my thoughts, and I know that we'll be also, I know University of Utah will be releasing the results of the initial Sublime study that they completed. And I don't have a date for that yet, but we'll make sure that each of you do receive an executive summary of those results, so you can see where some of the great research that University of Utah has been doing, what it's been revealing about the program. And we're excited to be able to continue to work with the University of Utah as a partner, and we're pleased that that you're willing to continue to help support the program by helping the University of Utah in new ways to help patients and medical providers in the industry in advanced research. So great.
I'll jump in on that comment if I may, Rich. I'm sitting here thinking about the past 5 years and all that the board has been involved in, and the program in Utah and the transitions that we've been talking about. And I really think, even though for some of us it's we've been here for a while, we're still in the this still just the beginning. It really is still just the beginning as far as educating providers. I still look around at my colleagues and how many are not involved at all. And a lot of new medical providers or trainees coming up that need to be educated. And then as far as research too, and then public opinion. We're still in the pioneering phase of this when you consider the actual numbers. So there's a lot of work to be done. And so we got to keep that steam, I guess, and keep that initiative going. I really liked, Sarah, that having those analytics for those pages that we created. We tried to keep them short so that, I don't know what to derive when people looked at it for a minute and a half or a minute and 20 seconds. Is that because that's all the attention they had, or was that enough to review one page of content? Because you start to lose people if it's more than that. So I I hope that that is representative of success, that they stayed on it for a minute and
Yeah, I took it that way because I feel like most people just like open a page, close it. So to a minute seems kind of like a good amount of time to skim through something or scroll through it and read it.
yeah, so I think if we're focusing on education, we take that in consideration. And even with the boxes that we've tried to create with the guidance documents, you know, it would take 15 minutes to read the whole thing, but most people are not going to dedicate that kind of time. So they're looking for certain things. And I think that's really important that we focused on that. Anyway, a lot to be said about the future.
So speaking of that, Michael, I know Valerie's not on, but do we know in terms like timing when we would be having at least an initial meeting, or are we yet to set that?
I have a couple, I know I have a meeting on my calendar for the CMCR. And I think that I'm not sure who is part of that one. I was just getting caught up on all my emails and things, and I think it was like, is this meeting? That's our steering committee for the CMCR is meeting on April 18th. Necessarily this group, even though Misty is on that as well. So I think we have some overlap. So I think that will be the next time, at least the CMCR is meeting. And I think we would set something else up then. I was hoping to talk to Valerie about that today. Who's doing what at which of the several upcoming meetings? So I don't know the actual answer to that, Taylor. But we do have some upcoming meetings with the university group.
Yep. Yeah, they've scheduled some meetings, and you'll get additional information. And Sarah, like she says in the chat, she'll follow up with Valerie and get info, and she can share that in an email.
With the transition plan, I think there's still going to be open communication, right? These aren't going to be two completely siloed different things between the state and the university, and this will just be opportunities to access more resources and more people within the university setting to kind of grow this education mission. So I think it'll be fantastic, and I'm really glad to have all of the board decide to keep moving forward with things. And so I'm very excited to keep working on this with everybody and bring in some of our other colleagues who can help us with some expertise on all these topics for more sort of one-off things, or however we decide to, structure things going forward.
Yeah. And one thing we'll be doing at the university or at DHHS is we're proposing to conduct a survey of medical providers across the state of Utah to ask them about barriers that they've experienced, if any, in their own efforts to learn more about medical cannabis or to participate in the state's medical cannabis program. And we do expect to get approval for that survey that we plan on sending out. And then we'll share the results of that survey. I'm happy to share it with this group and also with the University of Utah Center for Medical Cannabis Research, with lawmakers, with industry, and with Utah Medical Association. So they can all kind of understand, here's what we're hearing from medical providers about barriers that they experience. And we'll be asking questions like, have your patients asked about medical cannabis? And if so, what do you share with them about it? What barriers do you perceive in your own efforts to learn more? And other questions that help us get to know that group more. And we're hoping to get a healthy number of participants in that survey, although sometimes it's difficult to get medical providers to participate in surveys. But we'll be sending it out to all of the licensed physicians and APRNs and PAs and podiatrists in the state of Utah that have a controlled substance license, not just the ones in our program. So yeah, we're excited to learn more from that research that we'll be doing. And then we're not just doing a quantitative survey, but we're also doing a qualitative survey where we'll be meeting with those of that survey that agree to do an interview with one of our staff to that are trained to do some of these interviews, some epidemiologists, and they'll be learning more about what some of the medical providers have to say about their thoughts about medical cannabis and what they may have experienced in their if they've tried to participate in the program, if there's been some barriers, what have those been? If they have participated, what's their experience been like? Because there's a lot more, there's additional information you can glean from interviews, right, opposed to just a survey. So we'll be doing that after the survey where medical providers are just asked to complete something online. And then the University of Utah is focusing on one that'll be for patients about their experience in the program. And the option to participate in that will be given to not just active patients in the program, but also individuals that had a card who had their card expire in the program. And it's important to learn from those as well, right? Because we want to understand what some reasons why they may have allowed their card to expire. Maybe it's just because the product wasn't working for them, or it could be because they found they just couldn't afford the meetings with a medical provider, or maybe they couldn't afford the product. A lot to learn. I know also a lot of patients experience fear of discrimination with employers and things. So those are some of the barriers that we've heard about, and we want to continue to learn more. So we'll be doing that research and then sharing the results of it after it's complete. Those should finish up by the end of 2025.
We're kind of transition plan / board comment. Any other things people want to discuss from the board here? For maybe the first time ever. I love it by a wide margin, which is nice. For board comments, I don't know if we have any members of the public on. I know I see some other people there who don't necessarily have affiliations and names I see sometimes, but I don't remember who is who versus regular attenders versus public folks. So I guess we can go to a public comment period if anyone wants to raise their hand, and Sarah can bring up our little introducing yourself if anyone wants to say anything.
Hi, I raised my hand, but I don't know if you can like see that.
Alexis, go ahead.
Yeah, my name is Alexis. You can call me Lexi. I am a graduate student over at USU, so more in the northern part of Utah. But I am trying to submerge myself in medical cannabis research in the state of Utah. I originally moved here from Denver, Colorado, where I was doing medical cannabis research at the Medical University, CU Anschutz. I don't know if anybody knows that, but either way, I'm just wondering if it's possible to also attend the board meeting with a transition to U of U, like this whole board thing, as a public attendee as well, or how that all works.
Yeah, that's a good question, Lexi.
Maybe to be determined, unless Rich, you have an answer. I think by statute, it's not falling under the same public meeting framework as this, but it doesn't mean we can't invite public unless you have a better answer than that, Rich.
Right. Yeah, what I'd recommend, Lexi, is to reach out to Valerie because she'll control how those future meetings are put together. And I'm hopeful that there'll be an opportunity for you and others who have interest to provide input and to participate. And so what that looks like, that'll be up to, I think, University of Utah Center for Medical Cannabis Research. And so I encourage you to reach out to Valerie and she can help you with that.
Your email in the chat or something, I can connect you with Valerie, and or Sarah's got Valerie's email in there. And just because this is within the University of Utah, it's not going to be restricted just to the U. We already have USU folks. We already have other people from around the state who are going to be involved with that board. So it's not just restricted to that. And we'd love to have Utah State or anyone else or wherever you land in your career too. We can always use more people weighing in on different things. So if you want to introduce yourself to Valerie, you can CC me on there so she knows who you are and that you are at this meeting and things too. We can figure out what is actually going to happen going forward. So I think right now it's inviting more people to the party and figuring out who can help in all the different things, since the Center for Medical Cannabis Research at the university has an enormous mission in all sorts of domains. And not just what this board is doing, but lots of other things too. So there's definitely going to be room for lots of people to help out. And if it's just on a public or like a public attendee thing, we'll have to, like Rich said, see exactly what form that's going to take.
Well, can I comment on that, Mike and Lexi? I'm also an Aggie and a Ute, but I am an Aggie first, right? So awesome. But that brings up a really interesting question to me. I mean, we've been focusing a lot on medical research as it applies. I'm a clinician represented on this board with treating patients with cannabis, but Utah State, as we know, is an agricultural college, and I don't know how much research is being done at USU on the agricultural side of cannabis or the production side. But that's an intriguing question. And with our Utah Department of Ag, who's also been very involved in the program and overseeing the production and cultivation in Utah, how will that look going forward? Is the CRMC going to have an agricultural production arm, perhaps? I don't know. What is your research in, Lexi?
Yeah, mine is it's more in medical cannabis. So I'm actually going to be researching
that's fine. If that makes sense.
Medical cannabis in chronic pain patients specifically. So like different types of chronic pain patients. Hoping to do like a survey type format, or also like people's perceptions on why they use medical cannabis and how that is interacting with their different types of pain. So definitely not
Cool.
agriculture. That would be really interesting to see as well. But yeah, I'm kind of I'm an aspiring clinical psychologist. So that's what my research will entail. Yeah.
Cool.
I know
There'll be room for
Bruce,
you in CMCR for that sort of thing, and for applying for some of the grants and things like that, and collaborating with people. So
yeah, I'd love to collaborate. I did reach out to Valerie, and I think I'm in the same boat as y'all where I haven't heard from her. So I'll maybe try to reach out again. But thank you for answering my question. So
I know that Bruce Bugbee, professor of crop physiology at Utah State University, has shared some of his research at the symposium that the University of Utah Center for Medical Cannabis Research has organized. And he's attended those symposiums, and I know he has a crop of hemp that he does research with, and he's published on some of that research he's been doing. So he's in the Department of Plants, Soils, and Climate at Utah State University, and very engaged with the University of Utah Center for Medical Cannabis Research. From
Cool.
what I've heard and seen. So
thank you.
yeah.
all sorts of folks, from Bruce on the plant side to sociology folks to then like Misty doing our basic science end of things, and then our clinical research of looking at patient experience. So it's kind of hitting every domain around medical cannabis. It's not just focused in on one specific piece. It's basically anything around medical cannabis research of any facet of it falls within this new center. So there's room for all sorts of people to be involved.
Absolutely.
Any other public commenters out there? Comments from, I don't see any other public comments. Anyone else from our other state colleagues here who had anything to add in, or did I see Nanette unmute? I didn't mean to cut you off if you have something to say. Not then. I guess I'd bring it back to the board for any other final things to finish off our final meeting with. I think I will do one more round of thanks to everybody. As we often say in this, of standing on the shoulders of giants, right? I came into this only a few years ago when all of these initial documents had been done, and all the work by the board before that to do that with Perry Fine and Katie Carlson and maybe other board members that I didn't know then, all the enormous work from Lauren and all the literature review to help out with things there. Current Sarah and prior Sarahs in DHHS who have done so much too, and everyone else who has pitched in with us, all of our current board members now for collaborating on these documents, all the guest speakers that we've had over the years to help us better understand some of these topics and issues and bring things to light. I think it's all been really fantastic. The board has done some good things, and hopefully this will just set us up to build on things even more going forward.
Yeah.
Great. Thanks, everyone. Thanks to board members. Appreciate your service. And we will for sure keep in touch.
Thank you.
Yep. Thanks
Great.
all.
Everyone.
Thanks for joining. Take care.
Thanks.